Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Hello, everyone. Welcome back to another episode of the Healthy Chicago podcast. My name is Monica Mitchell. I'm a public health administrator with the Chicago Department of Public Health, and I work with the Family Connect Chicago program, which if you had a chance to check out our previous podcast that we talked about maternal mental health, and we had a partner with Beyond Baby Blues. But I'm excited to be back today with some new partners to talk a little bit about safe sleep, because October is the month that is dedicated to promoting safe sleep and raising awareness against SIDS. So I have my two guests here. I have Latonya. You want to tell the guests a little bit more about yourself?
Yes, I am a public health nurse with the Chicago Department of Public Health with Family Connect Chicago, where we do home visits on moms at 3 weeks of delivery. So we come out, we assess moms, we assess baby, talk about newborn care and postpartum care to ensure that mom and baby is healthy. And this is to help combat the maternal morbidity and infant mortality and morbidity in the city of Chicago.
Yes, thank you. And then we have Teo as a partner with us as well. You want to tell us a little bit more about yourself?
For sure. So my name is Mbande. I'm a partner of FCC with Chicago Birthworks Collective. We are a maternal wellness company. My mom and I started Chicago Birthworks Collective a little over 7 years ago, and we're really focusing on making sure that doulas are not just a Band-Aid solution and that we get to participate in the wide scope of maternal wellness things. So we've got education going on, we've got direct care with doulas, we've got a wellness team that makes the work of maternal wellness much bigger, like a full range community issue.
Yeah, that's good.
That's amazing.
Good work that you're both doing in this space. So with the work that both the doulas and FCCs do, like with safe sleep in particular, I guess with Teo, can you tell me a little bit more about what the work looks like when the doulas do the safe sleep education or even other newborn care education?
For sure. So I'll first explain what doulas do and then how we sort of apply to this specific topic. So doulas, I like to call us that middle lady. So we're the folks who provide all of the care that makes the puzzle fit together. So we're non-clinical providers who are experts really in prenatal care and postpartum care, so across the perinatal space. We're helping you sort of connect all the dots. So the time that you spend with your provider can be limited for so many reasons. Your doula is making sure that if you have questions, we're getting to the bottom of those questions. You have concerns, we're helping you voice those concerns. We also are sort of plugging in some information that you may not feel comfortable asking your provider. So much of what we do is about establishing trust and providing some comfort so that you feel comfortable to advocate for yourself, to ask questions. So when it comes to safe sleep, we're doing the same things. We're making sure that you feel comfortable to talk to us about where your baby is sleeping and why you've chosen to sleep that way with your baby. Why is that important to you? So even in the process of creating birth plans, we like to hunker down to the philosophy. So you can choose a certain thing, but why? And if we can get to the why, then we can really start to help you make good decisions for yourself. So around the safe sleep conversation, we like to ask parents, what first? What are the tools that you have and how are you sleeping? And then from there, we're asking, well, why did you choose to sleep that way? Well, I want to be close to my baby. Okay, how can we make sure that you're able to be close to your baby and then still implement some safe sleep? So as doulas, we're never here to just impart information. Mm-hmm. We're here to make sure that you feel like there's a trusting relationship that you have with this person who's a part of your wellness team. We want you and your baby to be well. You want your whole family to be well. And then we're also just filling in the little dots. Well, I didn't know that I couldn't sleep with a blanket in the bed, or I didn't know that it wasn't okay for me, my partner, and our kids to sleep in the bed. Okay, cool. So how can we strategize, move forward? So the same things that we do in preparing someone for birth, we have those same strategies when it comes to having conversations about safe sleep.
Yeah, and that's definitely important with the work that doulas do with like having the trust in the community and like with the families during a very period where people are already vulnerable at the perinatal stage. So one of the reasons why we wanted to definitely show the work that both doulas and nurses can do with promoting safe sleep and other health education. Latonya, do you want to talk a little bit about how the safe sleep works with the FCC visit, or even if people want to know a little bit more about what nurses do during the visits?
So just to piggyback on her, we do the same thing. And It's great that parents get the same message. That's what's important, that both providers, doula, nurses, and parents are all on the same page about safe sleep. And that's the first thing we do. When we go into the home, we assess where the baby is sleeping. And we talk about why you're sleeping and why it's not safe to sleep with your baby, why it's not safe to put your baby to sleep on the couch, why it's not important to, once you bring the baby out of the car in the car seat. Everybody's so scared to take their baby out of the car seat. Oh my God, because they're going to wake up. But that's not the safest.
Right.
And so we demonstrate how the car seat looks inside the car and how it looks when you put it down on the floor and show them the difference and why it's not safe for the baby. And yes, you might wake it, but try your best to tippy toe over with the baby, but the baby needs to go because of the head control, because of the slumpiness. And we show diagrams of what the baby's esophagus and trachea look like when they're crooked. So those visuals for moms and why moms like to leave babies in car seats. And we also say don't leave them in the swing to sleep, even if it reclines. Don't leave the baby in the bouncer. It's always safe for nap time and bedtime to go on their back in their crib, pack and play. And if you don't have a crib, we go through those issues of why. We try to connect them with their insurance company. For the audience, most of the Medicaid programs under the Illinois Department of Human Services provide pack and plays, sleep sacks, and they also provide car seats. So we connect the moms with the health insurance that they have, and we sit with them, we call and get those pack and plays. They don't have a place to sleep. And in the meantime, we talk about where can your baby sleep? In a dresser, in a basket, in a cardboard box are some of the items that we can utilize until moms get the pack and play. So we go over the risks and the benefits of sleeping with baby and the benefits that happens when you sleep, when the baby sleeps alone. So you can move around in your bed, you can stretch out,
no
you
neck
can
pain,
get
no back pain.
None of that. You can get a better sleep and you can get uninterrupted sleep with your baby being right there next to you in their own sleeping area. And it's recommended that a baby sleep with mom in their own space in the room for 6 months. So we prefer sharing the room, but not the bed.
Yes, and I think that's really important that you both share that with the room sharing, because I know with a lot of people, and particularly with some of the communities that we have of color and other cultures, you see like the co-sleeping is so common, you know, for that bonding period, but it's still a way to do it where it's still safe for both the baby and then like the mom can get some of those benefits too of like, you know, having a comfortable night's sleep too.
Right. And so usually at the home visit, I know the doulas do this too when they're at the home. If we see the bassinet or crib filled with toys, blankets, pillows, we have mom remove that stuff in a more polite and respectful way. And we also, on instances, I know that the doulas do, we have moved the bassinet or the crib into the room if mom needs to be. Because we want the baby to be right next to you, whether it's at the foot of the bed or side of the bed where you're right there, but they're ABCs. They're alone on their back and in the crib.
Right. And so much of what we do as doulas is really helping moms to feel like I have everything I need to make the best decision. And not always creating parents who feel like I need to look to someone else to tell me what to do. And so I think like clearing the crib. What do you think needs to come out of this crib? Let's see you put to action some of the things that you know. We really want to build confidence in our parents, you know, to make a decision, to know we believe in you and we trust that you're going to make good decisions. And I think that confidence comes when your wellness team, your providers, the FCC nurse that you have, they do, number one, affirm your choices and affirm what reasons inform your choices. So if it is a cultural reason, it's important to me that I'm near my baby. We understand that and we support that. And so with this information that we have, how can we get you as close to your baby as possible? Well, I get a little bit nervous when my baby's not sleeping next to me. That's understandable. How can we help you work through that? Is there someone that we can talk to, or sharing other stories of other folks? But I think there's just such a broad conversation when it comes to humanizing people and the choices they make with their children. And understand this is not a conversation of telling people you need to do this, you're doing that wrong. We know there's enough of that with mothers and with parents in general. So as doulas, I think we have such a special place to partner with nurses, because if you come and explain all of these things, we're coming to just smooth things out and make sure, do you feel good about this information? No one's going to get you in trouble, you know? And that's really a big concern for so many of our parents. Like, I'm doing something wrong, I will get in trouble. So we try to do away with the fear and enhance those feelings of confidence and I'm doing a good job. You want to take care of your baby. We want to see you being and feeling confident and taking care of your baby.
It empowers parents, too.
Yeah.
Once you allow them to voice their concerns, address their questions and answer, it empowers them. It makes them confident in their parenting, and it also with partners, with whether they're same sex or male, female, or two same-sex couple. It's always important that the birthing person and the partner also feel confident in their parenting. So empowering the parent to know what they do is a good thing, and helping them achieve that goal is always the end goal for both nurses and doulas. I would
We
say,
teammates.
Right?
We teammates for
Come
sure.
On.
Team safe sleep.
Yeah, because we always give the same message. As long as we're giving the same message, it's always like, oh, the doula did talk to me about that. And the nurse is saying the same thing. Oh, okay.
Yeah.
So they don't get mixed messages. That's the reason why I think the Sleep Seek campaign is amazing, because we all read the same literature. We all use the same data. And we kind of regurgitate the same thing. So teaching moms how to keep their baby safe, teaching partners how to keep their baby safe during sleep is an amazing thing, because the infant mortality and morbidity, one of the number one causes of death among infants under 2 months is SIDS. So we always want to combat that. And the best thing is safe sleep.
Yeah.
Yes, and I'm glad that you guys touched on a lot of that, because I know, like what you mentioned, you don't want to have the fear of people feel wrong, but it's also something too where we talk about with public health in particular, like prevention. So if we can give people that education where they know about the safe sleep, like that could be something when we look at one of the factors that contribute to that during the period is the sleep environment. So just having that be there. And then you guys kind of mentioned something about the clear the crib. So did you want to talk a little bit more about that for the viewers?
So for the audience and for mothers to be, clear the crib is an amazing baby shower activity. So the way it works, you put in a bunch of stuff in the crib, what people think the crib should look like. And then you give your the teammates, you pick a team, and you give each player 10 seconds to remove everything from the crib and what they believe a crib should look like. And then at the end, you then present, this is what a safe sleep looks like. And what is a safe sleep? Nothing in it. No bouncers, no pillows, no teddy bears, nothing but the baby. It's a flat fitted sheet that is reachable by the parent, because a lot of pack and plays come down with the bassinet part. So at the top part, versus having the one to sink down, you have the adjustable. So the baby is right, I think was it 3/4 or something that nature.
That newborn insert that sits them up higher.
Yes. And then the cribs also have the adjustable bed railings that goes high up and high down. And then you also have the bassinets, which is standard, which is amazing. But we don't recommend any of those sleep toys. So you have the pillows with the wedge thing. We don't want to use that. You have the boppy pillow that they're using because they want their baby heads. None of that should be in the crib. So it just should be your baby dressed in clothes, no blankets, no pillows, no nothing. So clear the crib is just a game. And I don't know if you want to piggyback on that.
So we've done it with our doulas, because as you mentioned, when you go into someone's home and you're like, take that out, I think it's an excellent way for maternal wellness providers to explore what the conversation around identifying things that shouldn't be in the crib can look like. So for us, when we play the Clear the Crib Challenge with our team, we're talking about, okay, if you spot someone's favorite teddy bear in there, you just taking that joint, you tossing it out? Or how are you going to let them know, this is beautiful? Tell me about where you got this and what this means to you. Let's put this in a safe place, because it could bring a risk to your baby if it's in the crib with them, you know? So for us, we're kind of taking a step further, because we may not be putting our babies in the crib with toys and blankets. But if you see that, how do you work on those skills as a provider to say, oh, I noticed something that you may have left in there? And also, our Clear the Crib baby doll comes with a binky, a little pacifier. And so that usually is the game changer. People don't know whether they should take that pacifier out or not. They're like, okay, well, you said everything out. So it helps all of our providers to really think through all the things that they might actually see in the home. Some people are like, no, give that baby its pacifier. I got to clip it to it. There are pacifiers that also have stuffed animals on the other side of them. So we're really getting to walk through every scenario so that our providers feel confident. And doulas should feel like, I believe this. I've practiced this. I've seen why this matters. And then I feel really confident. That confidence translates a lot when you're providing care for your families.
Yeah. So the clear crib is really nice. And they had a good baby shower, or when you have the baby shower events that's coming up, it would be nice to do the clear the crib.
Yeah.
And so we always try to put as much in the crib what people think it looks like. And you have 10 seconds to clear it out, and then educate why these things shouldn't be in the crib and the risks among the babies.
Yeah, those activities are really good at helping people to like kind of look at it and see, because you like think of how you would already set your crib up, and then like learn like why those things shouldn't be in there. And I like how you mentioned the pacifier, and then like Latonya, I noticed you have some items here that we usually share for those events. Can you like kind of share and show what that looks like?
So with the wintertime coming, a lot of moms are afraid that the babies are cold.
Yeah.
So the recommendation is no blankets, but wearable blankets. So when you have a blanket like this, the only thing that should fit in here is the baby with their onesie on. And it snaps and you're able to see the baby. The baby is nice and warm. The baby has a lot of room to roll if your baby is rolling. So when you have blankets, babies can get tangled in there. It can be over their face. But with these, it fits just like clothing, but keeps them warm. And for the summertime, they do have thinner ones that you can use. And this can be used for babies all the way up to 9 months.
Lots of space in there.
Yeah, and see how the bottom is, so they can kick, move, roll, and not get tangled. So we call these sleep sacks.
One of the things that I love about these sleep sacks is that they're a part of your bedtime routine. So, again, a lot of what we do, and you had asked this question earlier, as doulas, is kind of socializing folks around what your routines will look like. What is it like for me to take care of a baby, especially if you've never done it before, or if you're like me and you're like, okay, I'm doing this again. Putting your baby in a sleep sack is a part of your bedtime routine. You're not just going throughout the day saying, oh, that baby fell asleep, let me drop it in this crib. I am moving with intention. So, all right, it's 8 o'clock. Let me bathe this baby. I'm going to put a sleep sack on. I'm going to nurse this baby, put that baby to bed. And then you have some things that start to feel like these are my own practices. If you're going to oil your baby down, you're going to put the Vaseline on them before they go to bed, whatever the process is, we want you to feel like this is your own practice. And so remembering to do something like that brings back to mind, like, okay, I'm putting this on my baby because it's safe. This is the best thing to do for them. This is a part of our routine. And then when you start to talk to your own children, your siblings see, like, okay, the baby's getting his sleep sack, or my kids call that just like baby blanket. You're going to put the baby in his blanket.
And it's a wearable blanket.
Yeah.
That's what they're called, wearable blankets.
But the children see it, other folks see it, and then, you pass it down. You got your favorite sleep sack that you've been wearing since whenever. So I love that it is a tool that you can sort of implement as a part of your own practice.
Right. And that's one of the things that we go out and teach moms. We always, for me as a nurse, I always say, let's go to Amazon, let's go to Walmart, because everybody
shopping.
on their phone. And I say these are sleep sacks. We don't recommend one brand over the other. We tell moms to do their research, or if they prefer, depending on the price range. But get away with the blankets, use these for sleep, and then explain to grandparents, because that's one hurdle or one barrier that we run into as grandparents. Well, when you were little, I had you in the bed with me. When you was little, I had your auntie favorite blanket, and she crocheted that, and I wrapped you in that every night, and then nothing happened to you. This is true. I am still here. However, times have changed, Mom. And it's best that we sleep not with blankets, but with wearable blankets. And try no heavy blankets and no weighed down ones. Don't get those.
The weighted blankets.
Yeah, those are not safe. And then, especially at nighttime, always check the temperature of the room. If you're hot, the baby's hot. If you're cold, the baby's cold. And we always recommend that you put, if you think it's cold, put an extra layer of the baby on the baby that you have. So, for instance, have a onesie and a sleeper. If you want to throw some socks on, that's fine. We recommend no hats at all. So once you come home from the hospital, we recommend that you put the hat in a pretty little booklet. Say, this is my hat from hospital, but it's no need indoors to have a hat on. because you don't want to overheat. That's another cause of babies when they're overheated. So we always say, pay attention to the room temperature. If you're comfortable, then the baby is comfortable. So we say, if you're using a sleep sack, especially during the wintertime, if it's one of the fleece ones, all your baby needs is on a onesie. Or if you are, most moms, you have to listen to them, they don't think just a one t-shirt is good enough, then get a lighter wearable blanket and put your baby on its sleeper. Yeah. No t-shirt, but just a sleeper, and then put the baby in a sack. You don't want to overheat your baby by having a t-shirt, socks, hat,
the
sleeper.
Things. Like, who goes to sleep fully dressed like this?
And wrapped up.
Yeah.
But when it's wintertime, we get a lot of moms that are concerned about the baby getting cold. Yeah. So we just teach moms and parents and partners that what you should do is just make sure that the baby has on the same layer of clothes you do. So if you have on just your pajamas, then the baby should just have on his or her sleeper. Mm-hmm. But if you think it's a little chilly, go ahead and throw a onesie on under that and then the blanket. Just one extra layer for the baby.
Yeah, and that's good information for people to have with how to layer the baby, the sleep environment, the benefit of pacifiers. And another thing, too, which I think is always the mom's choice, but the benefits of breastfeeding.
Mm-hmm. Breastfeeding reduces, it is known, breastfeeding reduces SIDS.
I might be a little biased. I'm going to nurse that baby every single time. But that's also one of those...
I'm saying breastfeeding the baby reduces... Studies have shown that babies that are breastfed has a reduction in SIDS.
Yeah. And this is where I think doulas harness our superpowers, because we have partners like you all, like FCC, who provide us with really powerful data. And then we get to translate that into real terms. So what are we really saying? You got to breastfeed that baby. You got to put them in the ABCs. No. We're saying, hey, talk to us about what your parents did. Because as you mentioned, it could feel like a hurdle hearing, well, my mom didn't do that to me. Okay, tell me what they did. And let's affirm and celebrate all the things that your parents knew to do, all the resources they had, and the great job they did raising you. And then let's talk about some things you want to do. Mm-hmm. Let me tell you some things that we've heard of and present all of these things as options. There's just so much more affirming that we can do. And when it comes to breastfeeding, I think most parents want to give their baby the best option. And we are trying to just reduce the barriers. Mm-hmm. So what can make it difficult for you breastfeeding? Mm-hmm. Misinformation about where and how your baby sleeps. So lots of folks feel like, I want to breastfeed my baby, but I'm not getting up in the middle of the night to go get that baby. Let's talk about some solutions there. Let's talk about what that could look like, the type of support that you need. And then we take that information back, and then we talk to all of our partners and say, hey, the moms need help. They need help, y'all. They need postpartum doulas throughout the night. Yeah. They need lots of support. Their partners are tired. We're asking them to implement these components of safe sleep, but we're not providing them the type of support they need. It is exhausting. It is exhausting to do these things. And if we're trusting that parents are going to make good decisions, let's support them. Let's make sure that there's access to the care that's going to contribute to their wellness. So I'm going to always promote human milk for human babies. Mm-hmm. And then I also know all of the challenges that can be really, really mountainous against that.
And then all birthing persons who deliver at any hospital, most of them have lactation consultants that they can reach back out to ask questions, to voice their concerns, to get assistance. And if they're part of FCC, they can always reach out to some of the public health nurses, because a lot of us are certified in breastfeeding and IBCLC.
You was right there. Yeah.
All of those. So we have a few of those. So we can always help moms to navigate that breastfeeding, because we know breastfeeding reduces SIDS. But that's not to say that if you bottle feed or formula feed your baby that you won't reduce. We just talk about practicing safe sleep. Yeah. But breastfeeding is amazing way to reduce.
It is.
SIDS.
And it can also give you that time that you feel like you might be missing if you're putting your baby in the crib. Take that time to really nurse your baby. Sit with them. Watch that baby fall asleep. You might get a little bit tired, but this is why the whole family is involved. When you're getting tired, you falling asleep, you tell your kids, you tell your partner, wake mommy up if I fall asleep so that I can put the baby in the crib. Help me if their partner sees you knocked out. Y'all, how many times I've been nursing this baby and I'm gone. I'm going straight to sleepy land with him too. But if everyone in the family knows, you're not missing out. We know how important breastfeeding is, and we want to be honest about the barriers. You do have access to lactation consultants in most birthing hospitals in Chicago, but maybe they weren't there when you delivered, or maybe it was really hard for you to see them. There should be multiple layers of support. Your FCC nurse is coming saying, hey, are you breastfeeding? How's it going? After that visit, do you need more help? This baby is 6 months old, and I'm constantly coming up with new questions around breastfeeding. So we have to make sure there are multiple layers of support with breastfeeding, with continued safe sleeping. This is not something that we're asking or promoting for the first few weeks of your baby's life. For the rest of their life, let's figure out the ways that we can do this as safe as possible.
Right. And so there are always links that the nurses can provide, resources in the community. I always have them reach back out to the hospital of their choice, because that's where the certified lactation consultants are. Or we also use community-based organizations like
some
hers
of them are in the
community to utilize for breastfeeding, because we always want to promote breastfeeding, because we know that's a one way to reduce the risk of SIDS, especially among African American babies in Chicago.
Yes, it's good to hear about how that work goes with the breastfeeding, and then, which I know we're talking about SIDS, but there's a lot of health benefits for breastfeeding. So we do have like a lot of the resources that I know you guys use with FCC, and then also with your organization. We have the Chicago Department of Public Health, a website called One Shy Fam, which has information about FCC, safe sleep. We have a section that talks about doulas a little bit more and what they do, and some of our partners. So if people want to become doulas, there's information about that. But I know I wanted to see, I guess, if someone was a little bit curious about how they would connect with your organization in particular, like what would be the best way for them to do that?
Come stroll by our spot. No. We always welcome folks stopping by, but visiting us online, ChicagoBirthworks.com, is a really easy way. If folks are on social media, finding us on Instagram, we try to make it very easy for folks to get in touch with us. Occasionally people are like, I found your email, so I'm like, use it if you find it. Call the phone number that you have. Those are the easiest ways. You can just Google us. You can find your way to our studio. We're right in Hyde Park. So it's pretty easy to just walk in. And if I could tell you how many times folks have walked in and said, my wife just had a baby, I just need some help. Yeah.
Wow.
We had a dad on Mother's Day who was going to get flowers, and on his way home from getting flowers, he was like, I didn't know this was here. I have some questions. My wife just had a baby. So we love for folks to just stop by.
Okay.
And then they can find you on Instagram, Facebook.
Don't ask me about all the other social media,
All
y'all. I can hold down those too.
TikTok?
Not yet. I haven't got to TikToking yet. We haven't got there yet. My mom probably would be on TikTok, but not me.
Yes.
And then just to piggyback off safe sleep, we also recommend tummy time. And we say start off tummy time as early as you feel comfortable, as early as 1 week or as early as 2 months. And if you're not sure, always talk to your pediatrician on your follow-ups. And then we say no smoking and no drinking around baby. That is another hazardous for SIDS. So we as nurses, at least for me, I would say we don't care if you smoke. You can smoke whatever you want. You can smoke marijuana if you want, because it's legal in Chicago. It's fine. No judgment here. But what I do like to talk about is how to do it safely. So we educate them about removing their shirt after they smoke, and washing their hand, washing their face, and brushing their teeth. No smoking in the car. And we talk about secondhand smoke and thirdhand smoke. So we always say make sure that you practice safety. It's okay if you want. It's fine. No judgment.
Choices, because it's your baby, it's your life, it's choices.
So we just said just make sure you just practice safety. And then we also talk about the purple cry with safe sleep, because that fussiness. And this way, when the baby turns 2 months, they can cry uncontrollably for up to 5 hours. But we tell moms and partners and birthing persons to check and see if the baby is hungry. Check the diaper.
Go down your list.
Look over the baby and make sure you don't see any injuries. Check the baby's temperature. And just for everyone, a temperature of 100.4 is considered a fever, and we suggest you call your pediatrician right away to schedule an appointment to get into the doctor. And if all of that checks that none of that is going on, then your baby is probably going through purple cry. So we say do the 5 S's. Swaddle. Put the baby on side of stomach. And stomach and side is the only time that you're going to be holding your baby, and we reference side of stomach, because with back to sleep, the baby should always go on their back, never on their side. Recommendation is alone on their back in their crib. We say you can sing shh, shh to the baby, and this helps stimulate the common reflex that baby are used to in the room. Because think about it, your baby is 3 weeks, 2 months, but where did they spend the first 9 months?
In my body.
Yes, in the uterus. So you want to take them back to that point. So we say sing shh, shh, or put them in a swing or rock them, no shaking, and using either breastfeeding or using a pacifier. And that helps stimulate the sucking reflex that takes them back to when they were in the womb, which stimulates that common reflex. So we say go through those 5 S's, and if it doesn't work, take 10 minutes,
Put that
take a
baby
deep
down.
breath, put the baby in the crib, walk away, and just collect yourself, and then go back. And I always say it's okay to put some headphones on.
Yes, it is.
To soothe you. It's okay to go into the bathroom and let some water run, because water is a calming reflex.
Or go and cry.
Or cry.
I thought that's the water you were talking about.
That too. Crying and run.
I'm going to cry for a little bit.
Or call someone to help. Like, we always assess a parent support system. So sometimes parents are overwhelmed. So we tell dad to try the 5 S's. We tell mom to try the 5 S's. And if it don't work, just put the baby down, because no baby dies from crying in their crib. However, they do get injured from shaking due to frustrations of the parents. So we said put the baby down, call someone to come over and help. Call grandma, call your best friend, call someone to talk to. It's okay if you hear the baby crying. Just get yourself together, give yourself 10 to 15 minutes, and go back and try again.
Yeah. You're talking about a type of socialization that has to start in pregnancy. Everyone doesn't have someone to call immediately. And so we want to begin socializing you in pregnancy, that we are the people that you're going to call. You call this postpartum doula. You call your birth doula. Here are some other numbers that you can call, because we can't just assume that you got somebody. And we know folks they're doing their best. So we are teaching you this is how important and crucial your community is. We know that it's going to be tough. We know that the first year of your child's life, you are fighting for your life and their life together. So we're socializing you to say, here are the people that you can call on. We expect you to call us. We don't expect you to do this alone. That baby is going to cry. And I'm so glad that you explained what purple crying is, because so many parents are unaware that there is a state beyond all the things that you have done that your baby can reach, where they feel and are, for all intents and purposes, inconsolable. I've tried all the things. And so we have parents thinking, I'm constantly doing something wrong. There's something I must have missed. You didn't miss anything. This baby is going through a phase, and we've encountered parents who are just like, I cannot do this. I did all the things I learned in the baby class, and that's where we say, thank you for calling us. Thank you for reaching out for help. And we do our best to organize our troops and get out there, sending a postpartum doula, sending another mom. My mother is a grandmother, so I sent her first. I'm like, go help her mom. You got experience. But we have to socialize people to reach out for help. And know when you reach out, somebody's going to call. But it is a process to stretch those muscles, because so many parents are doing this alone.
And they're afraid of judgment. They're afraid of ridicule. They're scared that they're going to be saying, what are you doing? Or you don't know how to handle your baby. No, that's not what we're here for. We want them to reach out so they can get the help that they need, because so many parents and birthing persons who go through frustration of raising kids, especially if they have 2 or 3 under 3. They're very busy. So we want to help them learn how to time manage, how to sleep when the baby's sleeping. But when you talk to her, she has a 2-year-old that does not sleep at all. So how do we help mom navigate to that? What's important to her, like you said? How listen to her, express her feelings, assess what support she have or don't have, and help her come up with a game plan. And that's the most important thing when you're talking about how to navigate parenthood and keeping your baby safe, especially with sleep time and nap time.
Yeah, that's great information for people to hear, and what the work that what you do. I know like right now with Family Connects, like we have our partnerships with various birthing hospitals. So that's kind of how people can connect with Family Connects at the moment. But we will be having, like what you mentioned, in addition to a lot of different numbers, we will be having sort of a call center number in the future for Family Connects for people to be able to connect to Family Connects to have a visit with someone like Latonya coming out or one of our other many nurses that we have. And I do want to mention too, because I know we were talking a lot about just the benefits of the Clear the Crib and how it is a great baby shower game. We're going to have a lot of Clear the Crib and challenges throughout this month that we're doing with our FCC partners, but I wanted to mention one of the ones that we're partnering with the Chicago Police Department that is going to be coming up on October 19th. And it's going to be a community baby shower, and we'll have the Clear the Crib there, and then there'll be like education for safe sleep and resources for families. Some of our other partners are also doing events as well. So Rush is doing one on October 11th, where it's going to talk about SIDS, domestic violence. And then we're going to have another partner of ours, Sinai, doing one on October 25th. That's also going to talk about SIDS. So there's opportunities to go to some of those events if people can. We will have a newsletter that is going to come out for people to kind of get more information about those events. But we just wanted to mention it here as well. So thank you both for being here today. I feel like we could talk about this a lot because we're passionate about the work. So I do appreciate you. And thank you guys for tuning in. Please sure to check out one of our next episodes of Healthy Chicago Podcast.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.